This won't take long. I'm really grateful to all the organisers for allowing me to just speak for a couple of minutes. Now, rheumatology is a multidisciplinary speciality that sees patients with hypermobility, much of which you'll have been familiar with, but also autoimmune disorders. And there's a bit of an overlap in the sense that the words connective tissue disorder seem to apply to both hypermobility and autoimmune conditions. And I think that's a bit of a misnomer. So connective tissue disorders I'm going to call conditions like lupus, etc. And the collagen vascular disorders I find easier with hypermobility. So if you're at all confused by that, shout out. The aim of the exercise is that there's a lot of work going on, and you've heard all of that today. I've missed all of it because of a from hell, but I've arrived, thankfully. And what I want to just clarify is, how do we proceed with some of the fantastic work that's already going on, but specifically in the domain of rheumatology? And I've got an interest in both hypermobility, but particularly conditions like lupus, Sjogren's syndrome, which come under the autoimmune spectrum here. I presume this is, apologies, I'm trying to look for a, oh, there we go. Yeah, there we go. So what do we know so far? All of these rheumatic disorders have very similar symptoms, and fatigue, myalgia, muscle aches and pains. There seems to be a higher risk of Raynaud's phenomenon, the cold hands with the colour change. All of these are much more represented in patients with POTS and are very familiar to all of us with these kind of conditions. So the question is, mechanistically, could POTS actually be related? Clearly, we've mentioned hypermobility. I'm not going to dwell on that too much now, because clearly genetic factors may be responsible. But really, in terms of autoimmunity, could there be a mechanistic link? And this summarises some of the evidence that a variety of antibodies that circulate around may be associated with symptoms of POTS. And we know that in some studies, a variety of antibodies to nerve receptors, adrenergic and cholinergic receptors seem to be more common. And interestingly, in some studies like this one, symptoms of Raynaud's, aches and pains are also more common in those patients with POTS who have antibodies. So there are also studies that look at specific autoimmune conditions. So in this study here, about 31% of POTS patients had antibodies to potentially a variety of conditions. So the ANA here, which is anti-nuclear antibody, is commonly the test that we do to screen for conditions like lupus and Sjogren's syndrome. And these are not common disorders, but they have a profound effect on patients' lives. So the question really is, could some of these antibodies not only be associated, but potentially be causative for some patients with these conditions? What's the difficulty? So you've got some evidence here. It's nice evidence. It's early evidence. Well, the difficulty really is we don't yet know, looking at the rheumatology community of patients with lupus and many of these other conditions, how common is POTS in this group of patients? Is it something that bothers them? Is it something that actually they just put up with and don't know what it is? And this is really common stuff. You know, commonly with these kind of patients, they have symptoms which are not amenable to therapy, that actually GPs and even rheumatologists don't really pick up on, and they just pass off as part of the disease and need more steroids, that kind of stuff. But there may be mechanistic links and mechanistic ways that we can look at this. And we really need to do a survey in this group of patients to see, well, how common is the condition? Is POTS actually common or not? Following on from that, can we then identify patients, if it is found in a proportion of patients, how many? Can we then identify the patients who are at risk from this particular condition and which antibodies particularly seem to be associated, if indeed they are? And thirdly, once you've identified that cohort of patients, can we treat these patients specifically? And do they need a different treatment or much the same? And I've mentioned a couple of drugs here. So hydroxychloroquine I've picked out. Hydroxychloroquine is an anti-malarial drug, and it's probably the most commonly used drug for lupus. And that's my main interest. But it's often used for other conditions, rheumatoid arthritis, Sjogren's syndrome, all autoimmune in causation. So it seems to have a profound effect on not only helping symptoms of fatigue and tiredness, but the reason I've chosen this is there's some evidence that in patients who are at risk of getting these conditions, like lupus, who have antibodies already, it seems to prevent the progression from just having antibodies with a little bit of fatigue to actually having the full-blown disease. So it seems to be a reasonable start in therapeutic usage. And there are other immunosuppressives, all of which have their own particular side effects, some of which some of you may be on. I've also looked at these just ad hoc in patients who have POTS-like symptoms and found some of them to be useful in a proportion of patients. So we don't know any of this really at the moment. We're at an early stage in rheumatology in identifying who's at risk, how many people have it. Does it affect their life in any meaningful way? Do they find when they get home they can't function properly because of the POTS, not because of the fatigue? And we need to pick up on this. We need to try and identify patients who may be at risk, both from their antibody profiles, their symptoms, and we then need to find out, do any of these drugs work? Do they help patients with their POTS-like symptoms whilst also helping their autoimmune disease symptoms as well? So this is just really a plea for us to really try and get going on this. And I know Nick is very keen to get going, and hopefully we'll have some ideas of how we do this over cheese and wine later. But really, to start all of these, we need people. So I'm happy to do this. Nick, I hope, is happy to do this. I don't know if Arta's here, Arta Fedorovsky, but yeah. There we go. So, we may have collaborative research on this because I think this is an important field which is untapped. And it's another part of rheumatology which actually has been neglected probably much more than the hypermobility side has.